I do want to continue the introductions for you so that you'll know everyone who's here and the expertise that they bring to our panel. So once again, I want to thank all the panelists for spending their Saturday evening with us here tonight. And I introduced to you earlier Dr. Kurt Nielsen. He is the medical director of the St. Luke's Concussion Clinic. That clinic started in 2011, and he was really a dramatic force behind getting that clinic opened here. So we're going to hear from Dr. Nielsen. We also have Dr. Lee Beglinger. Dr. Beglinger is a neuropsychologist and director of adult neuropsychology at St. Luke's Rehab. She's been in practice for 13 years and has called Boise home for the past 5. Dr. Beglinger, if you'll just raise your hand and wave to everybody there. She's really an insightful provider, very thorough, careful observation, and articulate as she visits with patients and their families in navigating this challenging time after a neurological injury. And Dr. Beglinger is a really valued provider at the Concussion Clinic, too, when those neuropsychological services are needed. And Eric Taylor. Eric, if you'd wave at everybody there. He's a certified athletic trainer at Centennial High School in the West Ada School District. And Eric is really noted for his leadership in this area. He's been a tremendous leader in concussion management in the school setting, was one of the first providers in the Treasure Valley to establish neurocognitive testing for athletes. And he continues to be a determined advocate for student athletes and is certainly held in high regard by all who are fortunate enough to know him in our community, and continues to work on this with a lot of energy. Dr. Cherney is a pediatric neurosurgeon and the surgeon-in-chief at St. Luke's Children's Hospital. He was instrumental in the initial stages of developing the Concussion Clinic as well, a true advocate for patient-centered care for children. Dr. Cherney really does have an exceptional way of making patients and families feel as if they're the only ones that he is caring for. And he's the man. He's the brain surgeon of Idaho for children. So you have before you a tremendous panel of experts. I just encourage you to give them a hand and thank them for their expertise. All right, out of the pile of questions that came to us, I want to give this one to you panelists first, because I think after watching that movie, it's on everybody's mind. Can concussions kill you? A very serious question. Who'd like to take a stab at that?
Can concussions kill you? Wow, that's by definition, if we're talking about what we call a concussion scientifically, then having a single concussion doesn't kill you. It's by definition mild traumatic brain injury. Now, are there complications that can happen as a result of it? Could you have a second injury or another injury? Yes, you could. But I think the way we, or at least I, would interpret the definition of concussion, I wouldn't say it would kill you. Bruce, do you want to comment on that?
Yeah, I think that from a public standpoint, you may have your own version of what concussion may mean. There's sort of a somewhat scientific version, and then there's the version that we typically use in medicine. But the kinds of things and the head injuries that will kill you are going to be the really severe traumatic brain injuries that really take you out of the spectrum of what I think most people would consider concussion. And certainly on the medical side, on the treatment side, and the patients that we see in the hospital, a mild concussion or a concussion, by definition, isn't one of those things that's so severe where you present to the hospital in a coma and end up with a severe traumatic brain injury. So I would say, from the somewhat public definition, I would say no.
I think if I was a mom in the audience, probably where I would be on that question is, okay, I'm a mom, I have responsibility for my kiddos when they're little, playing sports, for example. These repeated concussions over time, maybe not a single event, but they're repeated, starting from childhood, moving through junior high, onto high school, and then college. Is it the weight of this and this question something that these moms and dads need to try to answer for themselves?
I've been at Centennial High School for 24 years and looked into the eyes of a lot of injured athletes. And I think, there have been situations where we've had athletes with repeated concussion episodes, and sometimes it's put them out of a sport. And it hasn't just been football. Sometimes it's been basketball. Sometimes it's been wrestling. And I think every situation you have to look at it on an individual basis and as a family, make a determination from there where your child is at, and how their schoolwork is going for them, and how their everyday interaction with their family and their friends is going. And if that is having an effect, then you need to take strong consideration into taking up chess or checkers or something maybe.
I will say that it wasn't really addressed in the movie. It has gotten some press over the years, but there's a very small subset of concussion patients that if they suffer a second concussion, a second significant concussion, before they have fully recovered, there's this entity called second impact syndrome, and there's been a number of somewhat highlighted stories of football players, some of them high school football players over the years, where they have had a concussion and were sent back too early. This has received a lot of press, and so that's probably the closest that one could come, where if you sustain that second concussion of significance before you have fully recovered, there is a small subset of those people who do end up with essentially malignant brain swelling, horrible malignant brain swelling. We do not completely understand the mechanism, but that is something that if it occurs in a small set of people, then yes, that's a very dangerous problem, and some of those patients have died from a subsequent concussion prior to full recovery of the first concussion. So it's a little bit analogous to the question that was asked, but we typically don't think of concussion as a single entity. But if you get that second impact syndrome, then that's a very serious problem, and people have died.
Really? Oh, no, please go ahead.
I was just going to add one point about the movie. You know, the movie's called Concussion, but really the focus of the movie is on CTE. And CTE is, you know, on a continuum, with normal concussion being at one end and CTE being at the other, of course. And there's been a lot of research looking at risk factors for CTE, what we know is associated with CTE, and the science is still kind of in its early stages of figuring that out. We think that there might be, you know, some genetic components to who might experience CTE. We do know that some people that have a long football career do not develop CTE. We don't know the percentage of people because we don't have large-scale studies that address this. But what I wanted to say is that a concussion, you know, in and of itself is on this end of the spectrum, and CTE is on this end of the spectrum. So repeated head trauma we do know is associated with CTE, but we don't know how many, how long. It's still, you know, in the early stages of research.
Dr. Nielsen, I think this might be directed to you. What are the protocols when a child shows all signs of a concussion? Is a CT scan done?
You know, there's a couple answers to that question. The first is when a patient rolls into the emergency department, if they've had a concussion, do they have to have a CAT scan? And the answer to that in most circumstances is no. Now, doing a CAT scan does not diagnose a concussion. A CAT scan is done to diagnose a more serious injury to the brain or the skull. So if you have an injury and you go to the emergency department and your physician is worried that perhaps you have a more serious injury, then yes, a CT scan is appropriate. So they're not appropriate in all circumstances. And there are some complicated criteria that physicians use to try to make the decision about who should or should not undergo a CT scan. The second part of that is the protocols that are in place. And I think that one of the reasons that we're here and part of the sea change that's happened over the last decade is what are these protocols that people are aware of and that they use in sports or they use in activities when somebody shows signs and symptoms of a concussion. And we always err on the side of being conservative and saying that if you are on a sideline caring for athletes and somebody shows signs or symptoms of concussion, then if you're in a high school sanctioned sport, you're legally obligated to take that athlete out of sport until they can be evaluated. That's what Idaho legislation states right now. If you're in a youth sports organization or otherwise, you're not necessarily legally obligated, but I think there's a moral imperative, and I think to the credit of most of the youth sport organizations that we've worked with, they have implemented protocols that follow that. That is, that athletes are removed if they're suspected of having a concussion. Now, there are other more complicated protocols that we can go into about what you do with an athlete who's come to your clinic or to your sideline or to your emergency department, and you've diagnosed them with a concussion. How do you then treat those athletes, and how do you then get them back into school and back into activities and back into playing their sport? I think we've come upon this Return to Learn program as something that we've adopted, that we think folks ought to get back into their full academic swing of things prior to putting themselves at risk of having another concussion. And we want to ensure that athletes have recovered from a concussion prior to putting themselves at risk for another concussion as well. And again, we can talk about that in more detail if we need to.
And
So-
maybe, Mr. Taylor, if the parents that are here aren't familiar with the protocol that happens where you are, right where things have taken place, what happens when you suspect concussion?
Well,
What should happen, maybe, is the best question.
I always tell parents, you don't, no offense to these guys by any means, but you don't always have to go to your doctor. I always tell parents, I never tell a parent or an athlete to not take their child to a doctor. If they ever feel in doubt, by all means, go see their physician. But typically, we advise them on the signs and symptoms. We give them a sheet that lists all of that out. And the old days of waking them up every hour, sleep is critical. I mean, they need to get rest. The brain, we have all sorts of items in our athletic training rooms and in clinics that help the rest of the body, but nothing with regards to the brain. It has to have rest. And we have our athletes come in every day and check in with us. How you doing? I always tell the parents while an athlete is experiencing symptoms, teenagers behind the wheel of a car when they're normal can be precarious. Don't do it while they have concussion symptoms. Reaction time, things like that can be compromised. So that's always seems to be kind of a motivating factor for parents and kids. Hey, I'm feeling better. Can I drive my car again? But once they're 48 hours without a headache and not taking any medication, I'll put them on a treadmill for 15 minutes, elevating their heart rate, getting a sweat going. And if they experience symptoms, a headache, then we stop, we back up until their symptoms are gone again. We try it again 24 hours later, 48 hours later. It's also different. And then we progress them from there. If they pass that, we return them to light non-contact activity. If that 24 hours goes well, then we return them to full participation. If that 24 hours goes well, then we allow them to back into game situations again. But the majority of the concussions that we see in our setting, the family and our nurse at the school, myself, we all work together in monitoring the athlete as they go along. But if they go 7 to 14 days and their symptoms haven't gotten any better, then these guys are absolutely our go-to. And from there, we need to figure out, okay, they need further help from their docs.
I want to ask you a couple things about legislation, but this question so dovetails with this, and it's asking about, she's a I'm not sure, a concerned parent of 2 high school athletes involved in high-risk sports. How are sports like football and soccer handling and educating players of the risks involved? That's the first question. And so my question along with that would be, Mr. Taylor, we know that you're heavily involved in your school. Is this something that's happening around our state? Is legislation requiring it? What is the status of that?
That is part of the legislation is education. Our website, most school websites have, once again, thanks to the Concussion Clinic, tons of free resources and information on there. We meet with all of our sanctioned programs. The club sports versus the sanctioned sports gets to be really hairy in our area, but we meet with all of our sanctioned sport kids, and and we talk to them and dispense literature to them with regards to concussion, and we have parent meetings as well, so that you know, my eyes as I get older are definitely getting worse, and so having many eyes on our student athletes goes a long way, and our parents are really good about getting a hold of us. Teachers get a hold of us. Their peer groups are incredible, because sometimes an athlete doesn't feel like they have a concussion, they're fine, and their friends are coming and going, hey, we need to have some further follow-up on so-and-so.
Well, and that really goes to the follow-up here. This parent says, I have personally heard players tell each other to say they have no symptoms when asked to prevent being pulled from the game or the sport. One of my boys has been diagnosed with 4 concussions by age 15. Now he tries to hide any symptoms with fear of no longer playing. So it sounds like what you're saying, and I would imagine you would concur, education is really the key here, making sure everybody's brought up to speed. And if this isn't happening in your child's school, now you know about the resource that the Concussion Clinic has online. You can use that as a resource. And just start asking questions and just being a part of the solution to that concern would be what I would imagine.
Yeah, I think that's the whole return to learn. I've found in our setting where the neuropsych testing years ago was an important component. I've seen what our athletes, our concussed athletes, do in the classroom is so incredibly vital. And if I see them in the morning and then I see them again after school and they've struggled at any point during the day, then there's a possibility we need to involve these guys, or we need to further take a look at backing them off of their academic classes, and then monitor them day by day to see when it's appropriate to be able to return them. But that's I really hope in this day and age that these situations with kids and friends, don't go tell your athletic trainer, don't go tell the coach about your concussion, you won't be able to play. I really hope, as we've come through this process over the last 10 years or so, that those circumstances are getting fewer and farther between. And that's why we need multiple resources, where the education component with the parents, with the teachers, with our administration, with their friends is so incredibly vital. And even in our health professions classes, we really hit this topic that you guys are the eyes out there for all of your friends, and it's a huge help when the peers are coming in and talking to us.
It's important. This question talks about legislation, maybe trying to make sure that it is more uniform. I understand legislation is trying to be passed regarding concussion education in young athletes. What barriers are hindering this potentially life-saving legislation? Who can get us up to date best on what's happening at the State House? Any movement on adding to the legislation that you've already gotten passed?
There was initial legislation passed in Idaho in 2010. It was updated in 2012. There's some major tenets to the legislation. First is education of coaches and student athletes in sanctioned sports in the state. The second is mandatory removal of those athletes from play if they're suspected of having concussion. And the third is that those athletes have to be cleared by a qualified medical provider before their return to play. So that's the state of the legislation in a nutshell in Idaho right now. Are there other things that we could add to that? Absolutely. There would be some expansion potentially to youth sport organizations outside of high school sanctioned sports or school sanctioned sports in the state. There are some states that have adopted a return to learn protocol as part of the legislation. Again, whether or not that should be mandated obviously is debatable. But there are a few things that potentially could be added or amended to the state legislation that I think might make it a little bit more robust. As of right now, that legislation in this session has not been opened up yet. So but it doesn't mean it can't happen, especially when there's momentum from something like this. The conversation is raised when there's a movie that's made like this and people are talking about concussion. I think political will changes to do things that are vital to help protect the community. And in that regard, I think it's a good thing when something like a movie can spur on public interest for the public good.
I really can't emphasize enough the power of a letter to your local legislator, your senator, your representative. It's amazing. From years of covering those folks, they say those letters, people who will take the time to actually write a letter and express their concern. Maybe something isn't happening this session, but when it's opened up next section, they'll remember that, I have some constituents that are concerned about this. I need to pay close attention or get on the, on the ball with that. So, all right. Well, how would a blow to the head by a soccer ball during a soccer game differ at all from a blow a football player may incur from a helmet-to-helmet hit?
It probably has to do with the impact and the size of the impact and the G-forces that are occurred. Now, if we're talking about a soccer ball hitting the head, that has generally less of a G-force than helmet-to-helmets in football. In soccer, you get head-to-head injuries, and there are definitely people who get concussions and injuries from being not helmeted. And they're not particularly running at each other generally to the same speed and the same degree and the same angle that they do with football. So I would say that the football impacts are day in and day out, because of the nature of that sport, have higher impact, moment to moment, day to day, contact to contact, game to game, than what's likely to happen in the whole realm of say, the sport of soccer. You do get concussions in soccer, there's no doubt about it. Oftentimes is the head-to-head kind of things, or just a bad fall and you actually hit earth. You get a tumble and a fall and you get on top of yourself and you actually hit earth. So the earth is hard, and so are head-to-head.
How big a role do mouth guards play in preventing concussions?
Well, I can tell you that the medical research has not established that mouth guards do prevent concussion in any way. They prevent dental trauma. There's a theory that perhaps if you're biting down on a mouth guard and you have your neck really stiffed up and the musculature in your head and your neck are engaged, that perhaps you're keeping your head from deflecting if you get hit. And some people hypothesize that's why people think mouth guards work really well. One of our panelists, who shall remain nameless, has some opinion that when he was boxing that that mouth guard definitely helped him, and I don't discount that in any way, but I can't look patients in the eye and say, yeah, I know if you use a mouth guard, this is going to help prevent you from having another concussion.
But it might save your teeth.
But it definitely can help save your teeth and preserve those pearly whites, Eric.
Oh, is there any way medically that, after watching this movie, this was the question I had. Is there any way medically to reverse the effects of a concussion later in life?
Well, we know that concussions, as you have more and more concussions, so repetitive head trauma is associated with more difficulty recovering from subsequent concussions. So once we get past, whatever the magic number is, which might be a handful for most people, the ability to return to your previous state, your baseline, we call it, is it gets harder and harder. So, and sometimes it takes less force, less trauma to cause a concussion, and that might take longer to recover. And then we also know that the accumulation of head trauma, and again, we don't know how many or for how long or how many years, is associated with developing, cognitive disorder down the road. I think the best thing you can do for a concussion is to be honest about your symptoms and let the concussion recover completely. We've talked about the return to play guidelines. There's also the return to learn, which is the cognitive part. So a lot of the patients I see are having a more complex concussion recovery, whether they're athletes or adults who have, fallen on the ice or had a head injury, a concussion from a work-related accident. I see a lot of those guys, and that's the minority of patients. Most patients recover really well from a concussion in the first week or two, but there's maybe 10% or 20% who don't recover in that amount of time. And those are the patients that, we worry about getting subsequent concussions, because if you have one bad outcome, you're more at risk to have a harder recovery with the next one. So I would say going back to whatever your cognitive duties are, whether that's work or high school or whatever it is, that's the return to learn component that we're looking for, that you're able to go back to your normal thinking duties and not have a headache and not have cognitive fatigue, we call it, meaning that you're just kind of fried, overwhelmed, your brain is full, in an hour, when normally you could sit there all day. So those are the things we're looking for, is that you're fully recovered from a cognitive standpoint as well as a physical standpoint before you put yourself at risk, for a subsequent injury.
This goes on then, at what age are concussions to be recorded or kept track of? I think you're kind of answering that, but our son had a couple before he was 4 years old, and now he's 9, involved in sports. Are those concussions, those earlier ones, counted against the number he could receive now?
I would say yes. I mean, I'm not a pediatric neuropsychologist, but I think the cumulative number of concussions is kind of what we're tracking and what we're worried about.
I'd say we're worried. I'm not sure we have the science to know that. We do worry about significant injuries in the developing brain, particularly the young developing brain. They do seem to recover pretty well, sometimes faster than we thought they would when we see them, and they have notable injuries. Sometimes they seem to recover faster than they would at an older age. But I think in the cumulative sense of if they had some as a young child or a toddler, fell off of something, and then do they have more concussions, I don't think we have the science yet to know over a long length of time, tracking those concussions, what their subsequent risk of, say, playing high school sports or beyond might be. I don't think we're there yet. We are worried about multiple concussions in a shorter span of time, but spreading them out over a time, and does the brain have capacity to heal from minor concussions? We generally think probably yes, but most people probably don't have 5 or 6 or 7, even if their parents were good at tracking them back to their toddler years. So I don't think we really know.
Do any of you know if statistics are showing that concussions have decreased in youth sports? This person's asking this question now that sports like football, those sports have incorporated some of these heads-up practices. Are we seeing anything, statistically speaking, regarding that?
Well, there were some independent surveys done on youth football that integrated a heads-up method of tackling, and have shown that there was a decreased likelihood of sustaining concussion in leagues that use that. And so, yeah, there can be rule changes that will decrease the incidence of concussion in a given sport. Then the flip side of that is the CDC also reports that there was a dramatic increase in emergency department visits for concussion in youth. But the interesting thing was, even though there was a big jump over several year period of time in the number of people that went to the emergency department, there was not a big jump in the number of people who were admitted with moderate or severe traumatic brain injury. And the implication there was that perhaps more people recognize concussion or realize they have a concussion or worry about concussion and present for evaluation. So it's hard to say outside of a finite area like youth football, where you can look at 2 different groups and look at rule changes and say, yeah, there are things we can do to make the sport safer. It's hard to say that statistically across all sports concussions are going down, or more concussions are presenting themselves, but that may very well just be because more people are interested in finding out about them.
And that's what the NFL is saying today after the report that came out that 2015, a significant increase in concussions in the NFL. Again, in regard to the movie that we just saw, what does that say to you experts in this? That we were talking the other night that we've come so far, and we really have. We did this 3 years ago. How many of you were here 3 years? Well, we were at the Egyptian, but how many of you were with us 3 years ago when we did a very similar panel? Anybody? Yeah, a few of you here. So we were just saying we've come a long way, but boy, then you read that this morning and you're thinking, oh my goodness, what's going on? What was your reaction to that news this morning?
Well, for those of you who didn't read the paper, the NFL has an end-of-year kind of concussion report, and this year was, for the last few years, there have been decreased numbers of concussions in the NFL during the season, and this year there was another great big spike, so it was going down, 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 and then it was up again. And so depending on how you wanted to approach that, there were certain people who were saying, well, see, the NFL really isn't doing anything. Concussions just happen, and it's just a dangerous sport. And then, a lot of the NFL was saying, well, I think we're actually doing better with independent spotters at picking up concussions, so maybe that's why we're seeing more concussions. In my opinion about that is it's one season. It's a statistical blip. And one season does not mean a trend. One season doesn't mean that the sky is falling, and it doesn't mean that you're suddenly good. So I think that, yes, as a sport, they're doing what they can to try to identify concussions, and they are making efforts to do that. But I also have a hard time saying with one season that's not a statistical trend. So I think could there be more rule changes and things that could happen in football to make it safer? Yes, and I think perhaps there should be, but I'm not real. I guess I'm not real emotional about that number, I guess.
Well, that's kind of good to hear that,
Yeah.
Yeah, hopefully they see that as an opportunity, and something that they have taken a long time to recognize is an entity and a problem, and something that does occur in their world. And so hopefully they don't see that as a failure of process of what they're doing, but they see that as an opportunity to analyze what they did. Is that different than what they've done before? A lot of work yet to do. Just try to slowly move that needle, towards improvement, so that the sustainability of the sport, continues, because that's what they want. But I think they just need to view that in the right direction.
Isn't this the first year that they had the spotters? So it could be that the fact that they have more eyes really working hard to try and pay attention to the athletes, and maybe that was a part of it. And Dr. Nielsen was right on, where after one season, don't get all bent out of shape over it. Give it some time. But I like the fact that, in this movie, they tried to conceal everything, and here, in this morning's paper, that is something that they're not concealing, that that they're willing to put themselves out there. And I love the fact that they have spotters up there paying additional attention to what's going on down in the field.
That really addresses this person's question about what the NFL is doing currently, the precautions they're taking. I guess we look to the NFL because they've got the money, and they've got a lot at risk. Anything else that they're doing that we should be keeping an eye on that might trickle down to youth sports that you're aware of? Better helmets, better, somebody's asking here about, let's see, what was it? I saw it was interesting. It was the neck band. How promising is the neck band that is currently being developed by the Performance Group, for example? Any of those kinds of things that we're seeing happen?
Well, I think the way you prevent concussion in sport really is rule changes. There's never been a helmet ever anywhere that's been proven to prevent a concussion. And you saw the thing in the movie where, Bennett Amalu had this, I don't know if it was a peach or what it was, inside a jar filled with water, and it was shaking around. And even if you have a helmet on your head, if you get hit, that thing still shakes around in there. And that's the mechanism of causing a concussion. So can a helmet prevent a skull fracture? Yeah, there's decreased incidence of skull fractures. Can a helmet potentially prevent catastrophic bleeding? Yeah, there's decreased incidences of that. But of the concussion, nobody's ever been able to prove that. And so we try to look for equipment. There are $1,500 football helmets now that have been developed with technology that is claimed to decrease the risk for concussion, and that's awesome. That's great that people are doing that research. $1,500 is a lot of money for something that hasn't really been proven, and in a clinical situation. So I think it's mostly rule changes, limiting contact time. It's making sure that the rules are enforced, that really helmet-to-helmet contact isn't allowed. I think it's efforts like that that are the most important thing. Heads-up football, heads-up tackling, things like that, that if this sport's going to continue, there just has to be more rule changes and limited contact time.
I think it should be, and I hope I have my facts right here, but as part of the settlement that the NFL had and has proceeded, for the past decade or so since this all came out, 2002, with the evolution of them understanding and finally, appreciating what the findings are, part of their monetary settlement set up a fairly large, and I don't know how many millions of dollars, research fund that has some independence to it, so it's not completely NFL hired, NFL, sanctioned, and NFL gets to review all the information before it goes public. They've swung a little bit so that they've allowed some independence. There's also a large group that is sort of the consultants that are out in that world to the NFL. There's a number of fairly prominent neuroscience people from neurology, neurosurgery, neuropsychology, et cetera, on down the road that have collected and still remain very active. So their research is involved not only for the elements of CTE like was in the movie, there are elements that have to do with prevention and equipment, and there are elements that have to do with all the other pieces of concussion and concussion recovery in between. So that is different than the initial studies that were done that were presented very briefly in the movie, which was NFL sanctioned, information that has sort of, kind of been shown to probably not have been entirely on the up and up, even though it was published with the group that they had. So a lot more independence has occurred and a lot more money, partly mandated as part of a settlement that the NFL has to put in.
Thank you. We're going to power through these last few questions here to try to get everybody, get your questions answered and get us going here. But Dr. Beglinger, someone was wanting to know what is neuropsychological testing, when should it be done? And I thought it might dovetail nicely with this question. When the brain is damaged/injured, does it recover completely or remain damaged? And from what I know of what you do, you have ways of really knowing that are related to this first question. So maybe you could jump into that.
Sure. So the neuropsychological testing, there's kind of two types. There's the computerized testing, like impact testing, that a lot of people do as part of their preseason, baseline. That's done on a computer. You can do that in a group setting. That takes about 20 to 25 minutes. And that's really valuable in helping us figure out, where is a person starting, and then if they have an injury, we hope that they return to their preseason level before they go back to playing. So that's a computerized type of testing. That's kind of a screening. Neuropsychological testing by a neuropsychologist is more involved, so it's comprehensive. And usually that doesn't happen for people who have a concussion unless they're having some type of a more complicated recovery. And they will have passed through, their primary physician, pediatrician, sports medicine doctor, athletic trainer before they get to me. So it's a small percentage that get a full neuropsychological evaluation. But if it's a person who's, it's maybe been a month or 2 or 3 or more, and they don't feel like they've recovered from their injury, they'll come in and get the neuropsych testing. That usually involves a detailed interview to find out about educational history. We know certain things predispose people to having a harder recovery, so these are risk factors like history of a learning disorder, history of migraines, history of depression. Things like that are associated with more vulnerable brains that don't recover as quickly. So we do an interview, and then we do testing, which is usually paper and pencil with a person, a one-on-one person that does it, and then we can kind of look at the profile. And certain profiles are associated with concussion in that small group who doesn't recover quickly, so slowed processing speed, problems with attention, those are things that we see fairly commonly. If it's an adult who's had maybe several concussions and they're worried about dementia or something like that, then the profile would look much more impaired. They would have, widespread memory impairment. So the testing helps us figure out which parts of the brain look like they aren't working, and certain profiles are associated with certain diseases. So that's the way that we do the neuropsychological testing, and that helps us figure out whether there's something that's still not working. And it's really helpful to have a baseline to compare that to. In terms of whether the brain has recovered or not, hopefully in a person who had an injury, maybe a sports-related injury or just an injury in adulthood, when we do the neuropsych testing, if it looks clean, if things look within the normal range, that's reassuring, and that happens a lot. That people have an injury, they've done whatever treatment they need to do, they've gotten rest, they've done maybe cognitive rehabilitation or physical therapy or OT, and they make a full recovery, and we can tell that from the neuropsych testing. If they have lingering symptoms, it may not be related to the concussion, it may be related to their post-concussive symptoms, like maybe they've developed depression or migraine headaches, and that can affect neuropsych testing. So it just gives us kind of a picture of how the brain is working and what types of symptoms the person is experiencing. And that helps us give information back to the managing doctor about whether they might need additional treatment or additional time to recover.
What parent or what percent of high school athletes do you think will be suffering from CTE in the next few years?
7? I have no idea. I'll let everybody else answer. I think what that question highlights how little we know about CTE.
Yeah.
There was an intriguing study that was done published last month out of Mayo Clinic has a brain bank, a neurodegenerative disorder brain bank, and they did a study on random selection of brains of folks who had participated in contact sports, folks who had never participated in contact sports, controls, and also people who had single isolated traumatic brain injuries like subdural hematomas or things like that. And interestingly, the only group in which they found evidence of the tau deposition in CTE was in the contact athlete group, and that was in about 34% of the brains that they looked at. And in the controls and in even the people who had single severe traumatic brain injury, they did not have evidence of that on their study. So if you have tau deposition, does that mean you're going to manifest the symptoms of dementia? Maybe, maybe not. I don't know. But that question highlights exactly how little we know.
Yeah, I don't think we actually have any way to tell you today with the CTE research really in its infancy in a way as to where that is, as far as how many athletes, whether they be in the NFL or college or even down to the high school level. And I don't want to, lend any scariness to things, but there was some, updated information that came out in a paper earlier this year, about middle of the 2015, and talking about the number of patients that at least have had documented CTE by pathologic specimen, meaning they passed away, and they had their brains looked at, and a few of those patients, or 153 total, a few of those patients had been high school athletes. So that's not to create this big fever of worry, but I think we're just learning more about the spectrum of what's possible, learning more about the findings of CTE, and learning a little bit more about the mechanisms that might lead to that. But there's obviously hundreds of thousands to millions of people engaging in all sorts of sports from youth on up, and we just have a very, very small population with documented evidence of this, and so there's a lot of work yet to be done before we can even come to approach answers like that or know even better information in the future.
And this person is wanting to know what research, if any, is being conducted at St. Luke's. What other research regarding concussions is being explored, and how's the progress? You've kind of touched on that, but what about St. Luke's? Is St. Luke's involved in any kind of clinical studies or anything that's happening?
We have a few clinical studies in the works. One is looking at quality of life and outcomes over a long period of time in our patients with concussion that come through the Concussion Clinic. So we don't really have a marker to know how well people do after a concussion for how long. Nobody's really looked at that over time, over decades, and how that bends the curve of how you do in your life. So we're doing that study. There's one that we're going to be looking at, sort of an advanced imaging study called diffusion tensor imaging, and looking at youth athletes. It's basically seeing if there are changes in the brain that happen after a season of playing an impact sport. We're hoping to get that done as well in the next year. And with BSU, we're doing a study on how parents and caregivers navigate the healthcare system when they have to take care of a patient with a concussion. So there's a few things that we have in the works right now. There are a million other things that we could be doing if we had more time and energy.
And maybe a little more money.
Money always helps,
Always
I guess.
helps,
Yeah.
Yeah, and I think specifically, just so people know, I don't think we're contributing at all to the research for CTE particularly. That's a much more smaller subset, and there's some centers around the United States that have been established, as resource places for that, and they're actively involved. But our community so far is not involved in that.
All right, we're 1 minute over time, so I'm going to try to get these last two questions in. So quickly, could a concussion from several years ago cause memory loss now? Could a concussion from several years ago cause stuttering?
Lee?
Dr. Beglinger, do you think that's good?
So I think this is a hard one to answer. Typically, the vast majority of people that have a concussion make a full recovery, unless you have a skull fracture, a brain bleed, something like that. It's considered a mild traumatic brain injury, and 99% of people make a full recovery from that. I would say it would be very unusual to have a concussion, one concussion, without other concussions. I think in the case of an athlete who's in contact sports and has been doing that for many, many years, even if they're not reporting concussions, there may be other, subconcussive blows that they're not aware of. In that situation, then I think there's maybe a little bit higher chance that you could see something many years down the road. For the average person who has just one concussion, maybe they hit their head on a piece of furniture, or they fell on the ice or something like that. Once they've recovered, we don't think that there's long-term damage associated with that injury.
All right, a final question is kind of specific here, but I haven't heard of it before, so it'd be interesting to know. Is the technology to conduct transcranial magnetic stimulation available in Boise?
Not that I'm aware of. If I understand the question correctly, I would say no, not that I'm aware of. Certainly not in the realm of concussion management or concussion evaluations or treatments. There is some, but I don't know if it is being done elsewhere. Most of my understanding about technology that has to do with transcranial magnet stuff has to do with epilepsy and seizure workups, management, and surgery.
Okay, great. Now, I'm going to let them have a final word here real quick, but thank you. Those were great questions.
I think a lot was brought up earlier with regards to rule changes. I think our state high school association, the Idaho High School Activities Association, I've been a part of their sports medicine advisory board, along with Dr. Pellant and Ty Jones, the director. And that association is fantastic. They are staying on top of, Angie doesn't let anything get by anybody. And the association has done so much. I look at the way that we played football in the 90s versus the way we are now, and the contact is so much more, and the coaches are buying into it. I think that's the other really nice piece is our high school activities association has such solid respect from our coaches from around the state that the coaches are buying into it. And while the NFL, maybe their numbers went up this year, I saw our numbers, we report them to the IHSAA, and I saw our numbers go down this year. And a significant rule change that they made was how much contact you have within a week's worth of practices and how much contact you have during two-a-day practices. Two-a-day practices are not anywhere near, as an athletic trainer, I love it. I can go home feeling really good at night that I haven't looked at 25 kids in one day. Maybe I look at 2 or 3, but we have made so much progress and using the evidence in order to make those rule changes. I really commend our association and our Sports Medicine Advisory Board for really accepting the evidence where we're at today and making those changes. So I don't think you should watch this movie and say, you know what, my kid is not playing football. I think you continue to educate yourself, see how your child is doing, and if they're doing all right, let them be a kid. Let them go run around and have fun, and continue to have that dialogue and education. That's my spiel.
And I can tell you just from visiting, I think you would all concur with, is that fair to say that his assessment is valid? All right. Okay, well, we can take a deep breath now and leave, and boy, please just enjoy the rest of the evening. Be careful as you go home, and thank you so much for being a part of tonight's movie and panel discussion. Great to have you here. Thank you,
And thank you,
panelists.
Dee.
Thank you. My pleasure. It's very interesting.